Hi everyone, welcome to childhood vaccination. Definitely worth the shot. My name is Rachel Myers and I am a health education and behavior student at the University of Florida. I'm here today to discuss the importance and benefits of vaccinating your children. Some of the things that we're going to cover in your time with me today is the benefits of vaccinations, the health issues that vaccinations can prevent, and then we're going to bust some myths on vaccinations. But first, we're going to start off with some information about the basics of vaccines. So, um, what exactly is a vaccine? Vaccines contain the germs that cause diseases, but they've been weakened to a point where they don't make you sick. And what they do is they stimulate your immune system to produce antibodies, and then over time, your body develops immunity to that disease. An antibody is a protein that is produced by the immune system to help stop intruders from harming the body. Invaders or antigens can be viruses, bacteria, or other chemicals. In this instance, the intruder is the germ or bacteria that causes the disease. Vaccines are so powerful because instead of treating or curing a disease like medicine, they prevent diseases overall. It is important to be educated on the basics of vaccines so that you can understand and communicate with your child's physician regarding immunizations. So let's take a look at the statistics. One of the obvious benefits of vaccines is that they prevent illnesses. In just over 20 years, they have prevented over 280 million child illnesses. That's a huge number, and there are many different things that are affected by a sick child that we will discuss later on. In that same amount of time, immunizations have prevented over 850,000 child deaths. Now, what I'm about to say next is something that many people don't think about when they think about vaccines. In those same 20 years, vaccines have saved 1.65 trillion in healthcare costs. That's a large chunk of money that can now be used for other needs. Most vaccines are covered by health insurance. For example, Medicare Part B covers flu, hepatitis B, and pneumococcal disease, whereas Medicare Part D may cover vaccines for other diseases such as shingles, tetanus, diphtheria, and whooping cough. Medicaid covers all recommended vaccines, and military insurance, or TRICARE, also covers all recommended vaccines. Other private health insurance plans cover different vaccines depending on the agencies, and you can always reach out to your local health department to find some local vaccinations for free or at a low cost. Now, I just want to go back to the $1.65 trillion in healthcare costs. That is so much money, and that doesn't even count the amount of money that parents spend taking off work, out-of-pocket costs, and all that. Especially when a child is sick with something like the measles, that can take months or weeks to overcome, and a parent is always going to have to take off work to be with the child. So they're losing that money that they could be making along with the medical bills. So that can take a huge toll on a family. All right, now we're going to go into the vaccine preventable childhood diseases. Up here is a list of a couple that vaccines help to prevent. And we're going to go into more depth with each of these in just a minute. The next slides might seem explicit, but they are real-life pictures of children with these preventable diseases. So I just want you to take a second and really think about what these children are going through. This infant has chickenpox. This disease is spread through air or direct contact. Normal symptoms in infants include a rash, tiredness, headache, and fever, and these symptoms can be felt after the vaccine is administered. But if your child experiences these symptoms, they should not be concerned because that is normal after the vaccine is administered. Complications include infected blisters, which are pictured here, bleeding disorders, brain swelling, and pneumonia, which is a lung infection. The varicella vaccine protects against chickenpox, and the CDC recommends that children receive 2 doses of the varicella vaccine, one at 12 to 15 months and another at 4 to 6 years. 2 doses of the vaccine is 90% effective in preventing chickenpox. Children can still get chickenpox, though, if they are vaccinated, but it'll come along with milder symptoms. So instead of these infected blisters, they might just have red spots, and instead of a really high temperature, they might have a mild fever or a low grade. This child, I'll go back. Okay, here we are. This is a child with tetanus. You can get tetanus through any cut or scrape in the skin. Symptoms might include stiffness in the neck and abdominal muscles, which this child is experiencing neck stiffness. And you can also see that he's experiencing lockjaw, where his jaw is locked into place. They might also experience difficulty swallowing, muscle spasms, and a fever. Complications include broken bones, breathing difficulty, and sometimes death. The DTaP vaccine is a shot that protects against tetanus along with diphtheria and pertussis, which I'll go on to explain later in this presentation. Children usually get 4 doses of this vaccine before they turn 2 years old. And then they get another dose at 4 to 6 years and a booster at 11 to 12 years. After that, the tetanus shot is recommended every 10 years. So for most of these childhood vaccines, it's pretty typical for them to have a large series of the shots before 2 years of age. And then most of the time before they enter the school age, before they go into kindergarten, a lot of schools require them to get the boosters before they can even register for kindergarten. And then by the time they're 11 or 12 years old, they should be getting the booster shot. This infant has pertussis, and that is spread through air and direct contact. Symptoms include severe cough, running nose, and apnea, which is a pause in breathing, which can be very terrifying for an infant when they stop breathing. Complications include pneumonia, which is a lung infection, and death. The DTaP vaccine covers protection for pertussis, which is the same vaccine that covers tetanus. Just like for tetanus, it's recommended that children get 5 doses of the shot, which are usually administered before 2 years of age, and then between 4 to 6 years, and then a booster dose later on at 10 to 12 years. These are children with polio. And polio is spread through air, direct contact, and the mouth. There may be no symptoms associated with polio, with the polio vaccine, but sore throat, fever, nausea, and headache may be present. Complications include paralysis and death. In this case, this is pretty severe. This child he obviously cannot walk upright. There are physicians and surgeons that go over to these countries. This is in Nigeria, and they attempt to correct illnesses and malformations caused by polio and other diseases. The IPV vaccine protects against polio, and children get 4 doses of the vaccine at 2 months, 4 months, and then 2 between 6 and 18 months, along with a booster at 4 to 6 years. Polio is a huge problem in countries that don't have access to the vaccine, and it is highly contagious. And these types of countries really need access to that vaccine. This child has the measles, and the measles is spread through air and direct contact. Symptoms include rash, fever, runny nose, cough, and pink eye. And complications include brain swelling, pneumonia, and death. The MMR vaccine protects against measles, mumps, and rubella. One dose should be given between 15 to 18 months, and then a second dose at age 4 to 6. And there's a lot of controversy right now around the MMR vaccine and autism, which I will go into more depth later on in the presentation. This child has mumps, and that is also spread through air and direct contact. The symptoms include swollen salivary glands, which are the glands under the jaw. As you can see in the video, his left side of his face is all swollen. It's also accompanied by a fever, headache, and muscle pain. And complications associated with mumps include meningitis, which is an infection of the brain and spinal cord lining, which can be very, very serious. Brain swelling, inflammation of testicles or ovaries, and deafness. The MMR vaccine protects against mumps. The CDC recommends that all children get 2 doses of MMR, starting with the first dose at 12 through 15 months of age, and the second dose at 4 to 6 years of age, which is the same as the measles vaccine because it's the same vaccine. And children can also receive the second dose earlier as long as it is 28 days after the first dose. The third disease that can be prevented by the MMR vaccine is rubella, and this can also be spread through air and direct contact. Some disease symptoms are rash, fever, swollen lymph nodes. Complications are very serious in pregnant women, and it can cause miscarriage, stillbirth, premature delivery, and birth defects. The MMR vaccine protects against rubella, and the CDC recommends that all children get 2 doses of MMR, starting with the first dose at 12 to 15, and then the second dose at 4 to 6 years of age, which is the same as measles and mumps. And like the other 2, they can also receive that 28 days after the first dose. So the last preventable disease that I'm going to go in depth about is diphtheria. And this can also be spread through air and direct contact. Symptoms associated with diphtheria are sore throat, which this person is probably experiencing, mild fever, weakness, and swollen glands in the neck, which are pictured here. Complications include swelling of the heart muscle, heart failure, coma, paralysis, and death. The DTaP vaccine protects against diphtheria, along with tetanus and pertussis. And children should get a booster vaccine called DTaP, which helps protect against tetanus, diphtheria, and whooping cough, or pertussis, at 11 or 12 years old. One thing that is common throughout all of these preventable diseases is the way that they are contracted. So most of them you can get through the air or through direct contact, so touching another person. So for example, if a child that was infected with measles went into a daycare or a school or even just a playground where another child that wasn't vaccinated because of some health issues, if they came into contact, then that child that's not vaccinated most likely would get measles. So it spreads like wildfire, and ever since they have come out with these vaccines, the numbers have decreased greatly throughout the United States. And that shows in, for example, in other countries like Nigeria, where polio is a huge problem and they don't have access to the vaccines. All right, now we're going to get into the benefits of vaccines. Many believe that the benefits of vaccines are something that hinders the child or something that isn't true. But I'm going to explain to you a few benefits that many overlook. For one, vaccines are the safest way to help a child develop immunity to vaccine-preventable diseases. They are safe and effective, and they all undergo long and careful review by scientists, doctors, and the federal government to make sure they are safe. And when I talk about long and careful review, I'm talking about years and years and years of testing, research, all that to ensure that it is safe. Because in order for them to supply it to the whole country, it needs to be safe. Immunization and vaccination protects future generations. Right now, all of these preventable diseases are basically all under control compared to 50 years ago when rates of measles and mumps and everything were over the roof, and a lot of people were affected by it. Vaccinations also protect others that you care about, including family members, friends, and grandparents. Like I mentioned earlier, some of these people might have weakened immune systems, or they might not have vaccinations due to health complications that prevented them from being able to accept the vaccine and have their immune system keep up with it and fight it off and everything. Some of the things that, or one thing that a lot of people don't get vaccinations for is if they have HIV or AIDS. So here is a picture of, like I was mentioning earlier. So right here, if only some vaccination, here, let me put this down over here. If only some people get vaccinated, the virus spreads. And if most get vaccinated, the spreading is contained. So right here, this one person has, let's just say, he's sick with the measles. All of these people in yellow are healthy and vaccinated, and all these people in blue are healthy and non-vaccinated. Fast forward a little bit, and now all these people who were not vaccinated but were healthy, they are now not vaccinated, sick, and contagious. Whereas these three people that were vaccinated are fine and healthy and all is good. Now, in this case, this one guy is not vaccinated, sick, and contagious. All of these people are vaccinated and healthy, whereas these three in blue are not vaccinated and healthy. Fast forward a little bit, this guy was only able to infect one other person rather than the 10 or so people that he infected before when all the others weren't vaccinated. So that's just a little thing to put it in perspective. But just imagine that little portion of people multiplied to the billions of people in the United States, or even just the thousands of people in your city, your town. And so now I'm going to have Miss Victoria Reyes come up and speak to you about administering vaccines, the makeup of vaccines, the common misconceptions, and some of her personal encounters with vaccines. And this will take about 15 minutes. now we're going to talk about some of the beliefs associated with the anti-vaxxers. Some people believe that it's better to develop immunity to diseases naturally rather than through vaccination, which so in some instances it works, but many instances that is just a selfish way of saying, I'm not going to risk my health for all these other people's that can't get vaccinated. Vaccinations may be harmful because they contain unsafe toxins, which I'll discuss a little bit more later. There's some controversy with the thimerosal and MMR vaccines and the mercury content in vaccinations. Vaccinations weaken the immune system rather than strengthen it, and that is false. Like I mentioned earlier, vaccines, they target the immune system to produce antibodies, which in turn makes your immune system boost and fight off the disease. Whereas initially you may have symptoms, like mentioned before, headaches, fevers, mild rashes, but they go away with time. And if they stay or they get worse, that is when you should seek medical help as soon as possible. Another belief by anti-vaxxers is that the majority of people who get diseases have been vaccinated. That is 100% false. Another belief is that vaccines cause many harmful side effects, illnesses, and even death, not to mention possible long-term effects we don't even know about. Multiple vaccinations for different diseases at the same time increases the risk of harmful side effects and can overload the immune system. This is all false, and this is just what people say when they want to believe that vaccinations are bad, but they don't have any research or medical experience to back that up. Now we are going to do some myth busting. One of the myths that people hear a lot is that vaccines cause autism. This is false, and according to the history of vaccines, most scientific and medical experts are satisfied that no connection exists between vaccines and autism and other neurodevelopmental disorders. And I have a video that I will share later that goes into more depth on that. A second myth that is common is that infant immune systems can't handle so many vaccines. This is false too, because infant immune systems are stronger than you would actually think. A baby would theoretically have the ability to respond to around 10,000 vaccinations at one time, which is outrageous. And number 3, vaccines can infect my child with the diseases it's trying to prevent. Technically, vaccines do infect the child with the diseases, but the germs are broken down into an amount that is not harmful whatsoever to the child. Vaccines can cause mild symptoms resembling those of the disease they are protecting against. But a common misconception is that these symptoms signal infection. Where symptoms do occur, the vaccine recipients are experiencing a body's immune response to the vaccine, not the disease itself. And better hygiene and sanitation are actually responsible for decreased infections, not vaccines. This is 100% false. Vaccines don't deserve all the credit for reducing or eliminating rates of infectious disease. Better sanitation, nutrition, and the development of antibiotics helped a lot too. But when these factors are isolated and rates of infectious diseases are scrutinized, the role of vaccines cannot be denied. Turn back. One example is measles in the U.S. When the first measles vaccine was introduced all the way in 1963, rates of infection had been holding steady at around 400,000 cases a year. And while hygienic habits and sanitation didn't change much over the following decade, the rate of measles infections dropped precipitously following the introduction of the vaccine, with only around 25,000 cases by 1970. So that definitely busts the myth that better hygiene and sanitation are the primary reasons why why infections have decreased. All right, and now we're going to go more into the myth about vaccines causing autism, which a lot of people believe is not a myth. Autism spectrum disorder is considered a developmental disability caused by differences in how the brain functions. And there is a large spectrum associated with autism. Some people may be higher on the spectrum where they have a harder time developing and learning and all that. And whereas some people may be on the lower end of the spectrum where they can function in society just fine and nobody would even know that they have autism. Thimerosal is a mercury-based preservative used to prevent contamination of multi-dose vials of vaccines. And then there is no link between ASD and thimerosal containing vaccines or MMR vaccine. A common misconception about vaccines is that they cause autism, and that is one of the biggest reasons why parents choose not to vaccinate their children. Thimerosal is a mercury-based preservative that is used to prevent contamination of multi-dose vials of vaccine, and it was thought that mercury might be causing autism in children. However, between 1999 and 2001, thimerosal was removed from vaccines in an effort to reduce mercury exposure in children, and it was concluded that thimerosal was not harmful. And currently, the only vaccine that contains thimerosal is the flu vaccine, and that is available without thimerosal as well for parents who are concerned. Now we're going to watch a video about vaccines and autism.
Hi, my name is Paul Offit. I'm talking to you today from the Vaccine Education Center here at the Children's Hospital of Philadelphia. Probably the question that's most been entertained, I guess, regarding vaccines by the media is the question about whether or not vaccines could cause autism. This notion was born really in the late 1990s, associated with a publication of a paper in a British journal called The Lancet, claiming that the combinations of measles, mumps, rubella, or MMR vaccine caused autism. Now it raised the question. You can argue that what this paper did, it raised the question. You can argue it's a reasonable question. I mean, for some parents, my child was fine. They got a vaccine. Then a month or 2 or 3 later, they started to develop signs and symptoms of autism. Could the vaccine have done it? Now, this is an answerable question. The way you answer it is you do look at large numbers of children who either did or didn't get the measles, mumps, rubella vaccine to see if you were at greater risk of having autism if you got the vaccine than if you didn't. And there have been at least 12 studies now involving hundreds and hundreds of thousands of children on several continents that have found the exact same thing. Most recently, there was a study that was published in the Journal of the American Medical Association. It involved a database of 91,000 children. And what they did was they looked at younger children where the older child already had autism, to see whether if that younger child got vaccinated or didn't get vaccinated, whether the younger child, when vaccinated, was more likely to get autism, and an obviously at-risk child because the older child, the sibling, already had autism. And the answer was no difference. Didn't matter whether you vaccinated or didn't vaccinate the younger child, there was an equal risk of getting autism. So all you did by not giving that younger sibling vaccines was increase their risk of getting vaccine-preventable diseases without in any way decreasing the risk of getting autism. Then what happened is the hypothesis, if you will, morphed to not that MMR vaccine caused autism, but that thimerosal and ethyl mercury containing preservative in vaccine caused autism. That was actually very easy to study. I mean, we had taken thimerosal out of vaccines in our country by the year 2000, at least as given to young children. There were Canadian provinces that used vaccines that contained thimerosal right next to provinces that used the same vaccines that didn't contain thimerosal. Western Europe took thimerosal out of vaccines by 1991. So it was very easy to do the kinds of studies to see whether or not thimerosal had any impact on the development of autism, or even subtle signs of mercury poisoning for that matter, and there was no association. Then more recently, the hypothesis morphed again. The children just get too many vaccines too soon, and that causes autism. Now there have been a couple studies that have looked at that, looking at children who got vaccines according to the recommended schedule compared to those whose parents had chosen to delay or withhold vaccines, and again, no difference in autism. So I think while we don't know what the cause or causes of autism is, I think what we can say with confidence is that vaccines aren't it. It's probably the best study of the environmental factors associated with that people have been concerned about regarding autism. Thanks.
And this is my reference slide. Now, what he was saying about the autism and vaccines, it basically makes it sound like parents over the years have just been grabbing at different excuses to blame autism on vaccines. And they're trying to link autism with vaccines rather than the fact that if you have one child with autism, the chances of your second child having autism are significantly higher than someone whose first child or previous children do not have autism. Like before, they were trying to say that the MMR vaccine caused autism, and then that myth was debunked. And then they were trying to say that thimerosal caused autism, and that myth was debunked as well. And then they were saying that children were receiving vaccines at too young of an age, where ultimately they just decided and came to a conclusion that vaccines and autism have no link whatsoever, although many parents still do believe that there is a major link. I hope that from this presentation you can take away that vaccines are indeed a good thing, and I hope you make the decision to vaccinate your children, not just for their own protection, but for their friends' protection, their family's protection, and for your protection as well. Does anyone have any questions?
Why do you think parents do not vaccinate their children?
I think the main reason why parents don't vaccinate their children is because they're afraid of autism. Where I'm not saying that autism is a bad thing, and nobody should think that autism is a bad thing, but they're trying to protect their children from getting autism when in turn they are just harming them by exposing them to preventable diseases. I think that a lot of parents, that's the main reason, and many of the parents that do believe that are actually wealthier, more educated. They are just firm in their beliefs. And the lack of access to vaccinations is not a valid reason, because you can get a vaccination at basically any health clinic. Your local health departments can steer you in the right direction regarding all that. And like mentioned before, Health insurances cover vaccines mostly. If you are paying out of pocket, it's very minimal and very affordable for most. Anyways, thank you all for coming, and just fill out the post presentation questionnaire on the back of your form and turn that in as you're leaving.
Thank you. Bye.